Director of the Johns Hopkins Center for Humanitarian Health and professor of the practice in the Department of International Health at Johns Hopkins Bloomberg School of Public Health. Professor, thank you so much for being with us on the program. I want to first off get your assessment of the current humanitarian situation in Gaza after a population of more than 2 million people have been deprived of much needed aid for 2 years now.
Yeah, I mean, unfortunately, the situation continues to remain horrific. And I think all of us are hopeful that the ceasefire that we hope will lead to a peace accord will actually allow the much needed civilians food, water, sanitation, nutrition, and health. And so we're really excited that this may occur. But in the meantime, there's going to be a tremendous amount to do in the short term if food and aid is allowed to go in unrestricted. And I think it's going to be a challenge, and I don't expect it to be simple. It's going to be complex, but there are clear priorities that we may wish to discuss.
What are some of those priorities, the most urgent essentials that are needed in the Strip at the moment?
Sure. Well, first and foremost is water and sanitation, and water is the most important as it's life-saving. And currently, over 90% of the water and sanitation infrastructure have been destroyed. On average, right now, the average Palestinian or the Gazan is receiving approximately 5 liters per person per day of water. As an example, I just looked up before this interview, and the average Turkish person uses 150 liters of water per person per day. And again, the Palestinians have around 5 liters per person per day. And so it's almost unlivable, and that's why there are many outbreaks, increases of diarrhea, and skin diseases. So water and sanitation are number one. Number two is food, and that needs to be unrestricted and allowed to come in, but needs to be all over. Everyone needs it. We can't have these small or limited distribution points. And we have to be careful that we have to give food to everyone, of course, but those that are very, very malnourished, and you were just showing a Lancet report that was by UNRWA, as well as actually my colleagues at Hopkins were part of the researchers, and is showing that there's an incredible amount of acute malnutrition. We know that there was famine declared in and around Gaza City and the Gaza Governorate. So there needs to be very specialized food that is allowed in with experts that understand how this food needs to be given. And I'll move on, but just to say also we need to think about shelter, and maybe we'll talk more about health.
Right. I want to shed some light on the healthcare system right now in Gaza because it's completely depleted. It's collapsed in its entirety. They don't have the resources to attend to patients that are experiencing life-threatening injuries. What needs to happen on that front?
So again, we hope, and the good thing is that there are organizations both inside and outside that are ready to help as soon as they are allowed to go in and as soon as there is safety and security. So because not just the infrastructure has been destroyed, over 1,000 healthcare workers have been killed inside Gaza. So there needs to be a mixture of infrastructure being allowed to come in, tented hospitals. There needs to be professionals and experts and specialists that need to come in. I do want to emphasize, though, as part of the international community has been doing this for years, is we need to make sure that we follow the lead of the healthcare professionals of Gaza and not just take over and do what we need to do, but follow what they need. And in terms of that, there's going to be ASAP trauma care is needed. There are so many people that are suffering life-saving trauma. Second, we mentioned the acute malnutrition, so there need to be therapeutic feeding centers set up. The primary health care has been destroyed, and so we need to be able to ensure that basic care is provided, specialized care for women and children, particularly pregnant and lactating women. And then finally, we don't always think about this, but in Gaza and most of Palestine, it's very important, are non-communicable diseases. We have an older population, everything from renal dialysis to emphysema, and they haven't been able to receive both either the medications and or the machines need to be brought in so that we can take care of them because they're in very, very bad shape.
Right, it's going to be a mammoth operation, a much needed one, though. Dr. Spiegel, thank you so much for being with us here on TRT World. I appreciate it.
Thank you very much.